Hey guys, Dr. Miriam here, family nurse practitioner at Innate Healthcare Institute. We have, if you haven't seen the news already, Trump announced that Leucovorin can be helpful in, he uses the term treating autism. I'm going to use the term improving symptoms of autism. Because it doesn't treat autism. It does help with symptoms. And so I am super excited about it. So this video is going to dive into what Leucovorin is, what it's doing, why we're using it, why I use it with ASD, with kiddos with ASD. But I'm going to start by saying, part of the reason I'm so excited about this is it's bringing awareness to something that we've been using for quite some time. And it's been around for a while. This isn't new. You can find some research articles, meta-analysis, where meta-analysis is like taking the current literature and putting it into one analysis and looking and seeing between all that data, what does it say? Dr. Richard Fry, who I think is also here in Arizona, works with kiddos with autism. He is one of the people that's published an article that I was looking at. So you can literally look at, Google something to the extent of cerebral folate deficiency and autism. You can Google folate deficiency or FRAT test, FRAT, and autism. Any of those things will come up. His article or an article similar that you can look at for the research. But the reason I'm excited is because in that statement alone, parents that had no idea, because we talked about it with our parents here, but parents that had no idea about Leucovorin FRAT test and the use of Leucovorin, how it can help. Now they're being informed and they're looking more into it. Providers that so many providers that I have, working with our patients, that I have sometimes tried to reach out to them or send the parent a note that says, hey, we're working with a mutual patient, and I would like to put them on Leucovorin. This is what I'm recommending. This is how I'm recommending it to be taken. Would you be willing to order it for them? Because that's how they get coverage through insurance, especially if they're on like a Medicaid type plan. And they won't do it. They don't know what it is. They don't know how to use it. And so this for me is a great way to start to allow just the knowledge to start being disseminated a little bit more to providers. So hopefully they're a little more open. And then in addition is the insurance companies, because with that statement, could we potentially see then the move for insurance companies moving toward covering it? So for all those reasons, I love it. Now let's move into what it is. Leucovorin is an intermediary. So it's B9. So Leucovorin is folic acid, but in a state that is called folinic acid. So you have vitamin B9, which is folic acid, what pregnant women are instructed to take during pregnancy to prevent neural tube defects. You have that state, you start to reduce that down, and you have the intermediate. So the most reduced form is methyl tetrahydrofolate. You will see that in a lot of methylated vitamins, which are the vitamins recommended for most kids with autism, because we don't know if they have issues breaking down those vitamins. So methylated means it's already broken down. The body can use it really easily without having to go through that enzyme process of breaking it down from folic acid to this methyl tetrahydrofolate version. The intermediary between those two is folinic acid. So folinic acid as an intermediary is it's like the secret sauce. The reason we can use it in kiddos that are positive for the FRAT test, which I'll explain in a second, is because it's this intermediate. It used a different receptor or entry point into the cell than this final version that is the methyl tetrahydrofolate. So we have these two versions, most reduced, most accessible, but if there's something blocking it, you got to use the Leucovorin. That's kind of what the Leucovorin is. Leucovorin was branded as Leucovorin, so folinic acid branded as Leucovorin by the pharmaceutical company that patented it. You can also, so that's a tablet form. That's the form that's covered by insurance. You can also get straight folinic acid. That is from a compounding pharmacy. That I use sometimes for kids, because sometimes there's other fillers, not sometimes, there are other fillers in the tablet that is used to create folic acid or Leucovorin, that some of those fillers affect our kids differently. And so using the folinic acid from the compounding pharmacy, this kind of cleaner version, avoids those things. It just gives you, as pure as can be, folinic acid, and potentially helps us with any side effects, which we'll go into in a bit. So that's what the actual supplement they were talking about is. And let's get into why in autism. So the research shows that 60 to 70% of kids with autism have developed an antibody to dairy. So when they consume dairy, the body produces an antibody. It's an immune reaction because in consumption of dairy, it comes down to the root cause is a leaky or permeable gut. That if you think of the leaky gut so if you think of the gut lining cells as being super close together like this, and nothing permeates between, you have these bonds that go between called zonulin. If those bonds are broken and found in the stool test, which is part of the testing that we do, now the cells are going to be, they'll go from slightly apart to like they can go pretty significantly apart. The zonulin level measures, are we just like a little bit, or are we getting pretty separated here, right? And so if it's starting to get separated and now the bond is broken, and you find this in the stool test, it means these these cells are not super close together. What happens from that? Then you can get food particles. You can get particles from bacteria, LPS, lipopolysaccharides get across, a lot of inflammatory chemicals in the food particles. That's how dairy gets across. That's how gluten gets across. Those are two biggest things the body attacks and is called sensitized to. So the body creates an immune reaction, and then that reaction stays in place. Once the body has seen this foreign entity, just like an illness, anything that the body is trying to remind itself of the presence, so that next time it sees it, it can come after it and attack it. It's the normal process the body undergoes. That's what happens with food. And so in this case, it's happening because of dairy. The exposure to dairy, the leaky gut, exposure to dairy, body mounts an immune response, an autoantibody. That antibody, once created, free floats. That antibody also creates a lot of inflammation in the body. If you got inflammation in the gut, you got inflammation in the brain. The antibody free floats when it gets to the brain. In our kiddos with autism, we're finding that 60 to 70%, and that's research. In our office, we're finding about 75% being positive for this antibody. The antibody will either block or bind to the receptor on the cell in the brain trying to use folic acid or folate. So basically, think of a receptor as like a projection from the cell. So if I'm the cell and I'm trying to use folate, this projection is the receptor trying to grab onto, the floating folate, trying to grab on, bring it into the cell so that it can work with it and shift it and change it, work with other cofactors to create the response it wants. And so if we have this free floating antibody and it now blocks, so blocking is literally standing in front of blocking so that folic acid or folate can't get through, or it's binding, so it's actually sticking to, both of them are making this receptor unusable. So that if folate can't attach to be brought into the cell, this becomes ineffective. The other form is that if you imagine, and I'll talk about the FRAT test a little more, but there's a form on the FRAT test that basically indicates that the receptor has been blocked and is like free floating, like it didn't get used for so long, is my assumption. Not sure exactly how that's happening, but it's not being used. And so it actually breaks off from the cell and it's just kind of free floating, which is not super common, but that's kind of like the third blocking, binding, in this free floating version, so that that's what you can understand it as. So that's what's happening, is this antibody is so prevalent in our kiddos with autism that's why a lot of practitioners will say, just as a general rule, go casein free or dairy free. This is the reason why. And so if you don't have the test, it's a good idea to go dairy free. But if you do have the test, that's where we actually get to see, is the diet change needed or not. So what's happening is that if your cell, so my body cannot use folate because it's blocked or bound by the antibody, I become like a rusty wheel. I haven't been using the folate, and I can't go through the processes I need to affect. And this is the areas that are affected when there's deficiency, also called cerebral folate deficiency syndrome, is that you're going to have more challenges with speech and more challenges with cognitive function. And I try to explain to parents as like complex cognitive function, so multi-step processes, where then in supplementing, those are some of the areas that you see improve. So that's why people say, oh, leucovorin can help with speech. Yes, because the very area that is of the brain that needs folate, or needs folic acid is the one that's deficient. So you're potentially having lack of speech. So that's the mechanism. That's how the whole thing's happening. And that's what's happening to our kiddos. And so then when we look at supplementing, so we want to get folate back into the cell, that if we use just traditional methylated vitamins, then that's going to go into that of the two forms, it's the most reduced form, methyl tetrahydrofolate, that uses that front door entry. If that is blocked, we can't get in. So you can give as much as you want, because the issue is not that the kiddos don't have enough, that they can't actually use it. So that version is going to try and use the front door, and we want it to use the side door, which is where leucovorin comes in. So leucovorin has this side door entry into the cell. Keep in mind that, with what we work with here, using the MSCs or medicinal signaling cells, that it actually works synergistically in this process where it helps the antibodies, it helps them to reduce, it helps to modulate the immune system, change the immune system, and it helps the cell become more sensitive and potentially that door to stay open even longer for the leucovorin to more easily go in. So that's how, using the MSCs, it synergistically works with the FRAT test and the exosomes. Really, it's the exosomes, right? But MSCs release the exosomes. So in doing that, we're synergistically working with trying to get speech, trying to get this cognitive function, because we're trying to improve the cell. So then when we start to flood the cell with leucovorin, this is where, in replacing the folic acid or folinic acid through leucovorin or just straight folinic acid, that's where we see the improvements in the speech and the cognitive function. I've had parents tell me, I have a parent of a kiddo who's 9 or 10. And they told me for their son, they started noticing improvements, not only in speech for understanding. Like mom had asked, I'd asked kiddo to, he had come to mom with the iPad, basically saying that the Wi-Fi wasn't working. And she looked at it. She said, oh, go tell your dad that it's not working and have him fix it. That's a multi-step process. Tell dad it's not working, ask him to fix it, right? So he went upstairs, handed it to dad, and basically said that explained in his own way that it wasn't working. That's a multi-step process. For a lot of our kiddos, they either wouldn't understand the full breadth of that statement and what to do. And he didn't. The parent said that's really different. In addition, then at a family function, normally he tends to hang back, tends to find a room and just hang out in the room the whole time and not socialize. After being on leucovorin for an extent, probably a couple months already, he is one that we did have to switch to the folinic acid version. I can explain that a little later. But after being on it for some time and getting him to the dose, because it is dose dependent, getting him the dose that he was really, being able to get sufficient folate into the brain, folinic acid into the brain, to get it used, to get that engine running properly. Once we got into that steady state, once he was able to use it well and his body was able to adjust to it well, that's when they started seeing bigger and bigger changes in speech, him trying to use more words, him trying to connect words. And he's not fully using words, but he's trying more and more. And that has increased since they started using the folic acid. And so, but then also, instead of hanging out in the room, he came out and played the whole time with his family members, with his cousins. So that was a huge shift for parents, for the parents, and to where dad was like, whatever that is, don't stop it. Which is super fun, because it really comes down to, it comes down to the family system. It comes down to, how can we help, right? How can we work with kids to improve symptoms, whether it's leucovorin and the MSCs, whether it's just the MSCs, but we're talking about leucovorin. So, is really, how can we make the whole system work better as a family, as a unit, as, going out and living life in the way that you want, having the experiences you want. And that's really awesome that we were able to help them in that way and to work with them. And so, let's talk about dosing. With the announcement that happened, I know a lot of people are just going to flood trying to get providers or trying to get this medication prescribed for them. And I have, as someone who talks to families all the time, does consultations with them, I've had plenty of families that have come to me, and providers, they're trying to be helpful, but they don't understand how to work with it. And here we do. We've done the trial and error. We've worked with lots of kids. We've been doing this for over a year already, consistently with lots of our kids. And so we understand the nuances of what does it look like when you're working with leucovorin. Because if we're starting that factory up, that rusty factory that hasn't seen folic acid or folate for a while, and we're starting to feed that cell and asking that rusty system to wake up and work. It's not just that system that works. That system actually needs other components, other workers within it to help it move. Those are our B vitamins, our B complex. And so I tell parents, if you have your kiddo on leucovorin, and if you're working with us, we're already going to do this, is that they need to be on a good multivitamin, because that good multivitamin, or at least a good B complex, that B complex, especially B1 and B6, and B12, work with the B9 as cofactors. They need each other to work properly. And can it work without? Yes. Can it work as efficiently and as well? No. And can you get more side effects? Likely. Because if we're getting a bogged down system because we don't have the other workers helping to process this through and move this along the way it needs to, you're going to get breakdown. You're going to get more issues. And so that's where having the multivitamin or B complex on board, I say first for, I would say 5 to 7 days. That's my own experience. There's no hard, fast data on that, but that's my own experience. 5 to 7 days, have that on board and make sure you have the cofactors, and then start into the leucovorin. And then with the leucovorin, I start real slow. I start real slow, once to twice a day, and then slowly titrate up. And we move from there, and depending on the test. So a lot of people will say, do I have to get the test? When you don't have to, but if you really want to know, or if you really want, to have an informed decision about like, what's best dose for your kid, then you need to know what the FRAT status is. So the FRAT is the test, the folate receptor antibody test is the test that's looking to see, do you have a binding antibody, blocking antibody, or that SFR, that kind of free floating one. It's a blood test. We do it here in the office. So that test tells you if you're negative, and we just do a trial of leucovorin, because I even have kids that are negative, although they're not being blocked. There's something happening. They're potentially not being able to use that forward receptor well. So I have, a 9-year-old who, I think he's 9 or 10, lots of awareness, lots of understanding, went through the rounds of cells with us. And had, really great and positive outcomes, but his dad was really looking for speech, as many of you are, as many of our families are, and was a little frustrated that he wasn't getting it. And at some point we kind of say, like, there's only so much we can do. We can keep working. We can keep, we have CC, our autism communication specialist, who talks to our families and helps them understand how their kiddo is communicating and how they can communicate with them differently to get different outcomes. And so we do all we can. We use the medicinal signaling cells, we use the MSCs. This is when we just started using the leucovorin. This was a little while back, but I told him the test came back negative. And I said, hey, if you want, let's trial leucovorin. I usually trial for about 3 months, and let's see if we get improvements. Within 1 month, that kiddo had 20 words. So it goes to show that even if they're negative, they still could use, the leucovorin, and sometimes it still helps. So we trial it. But I go up to at least, 20-ish milligrams per day. I don't go higher than that usually. And then if they're positive, then you got to make a diet change that's dairy free. And that's a big diet change. And if we don't know that, and they're actually positive, and we don't make the diet change, you're just relying on this side door. Like, that's all you're relying on, which isn't the optimal. The optimal is actually to be able to use the front door. Although we can use it, you really want to get rid of these antibodies. And the only way to do that is actually come off of dairy. The body stops being sensitized over and over again. Because keep in mind, if the body's already seen it and sensitized and is heightened to the fact that dairy is the enemy, every time it sees it, the body is attacking it. The body's going after it. You're creating inflammation. You're creating a leak your barrier, leak your gut. And so parents will say, do I really have to go off dairy? Because my kid's really picky. That's the only thing they eat. And I say, well, that's up to you. Because my recommendation is absolutely, when we understand how much it's harming our kiddo, and understanding that, yes, your kiddo is going to push back on you and say, I don't want this, or I don't want that. But if you can understand from the standpoint of, this is actually harming my kiddo, then you get to make the decision that's best for them, to say, I understand, and yet you can't have that dairy, right? And I would say it as far as this goes. Don't go cold turkey. We don't like going cold turkey on a diet. Most of us fail. So it's the same thing with our kids, right? If we're changing their diet, don't go cold turkey and like all of a sudden everything is new and different. You are going to get a really unhappy kiddo. Start little by little. So maybe you start shifting and adding in, some almond milk, or maybe you start like coconut milk, anything that is not from an animal. So anything labeled even vegan is the easiest way to find products. If they're labeled vegan, beautiful, perfect. That's what you want, because that means not by an animal. Any milk by an animal. So people are on the fat of camel milk. Not as immune sensitizing, but still sensitizing. It still has it's really the casein. So anything from an animal is a no, but especially cow's milk dairy. It is the biggest culprit. And so anything labeled vegan is totally fine. So almond milk, cashew milk, coconut milk. I mean, there's so many options, even compared to like 5 years ago now. So, and if you want some guides, we have guides here for dairy-free, for gluten-free, for different things. So, when you're in the office, when you're talking to us, you can always ask for a guide. Um, and so, yeah, take away the dairy, go slowly, little by little, change the foods over. I had a mom I was just talking to. She's like, well, we have like a ton of, ice cream in the fridge. I can't just get rid of it. And I was like, okay, then take the month, finish off what you have. When you buy at the store, the next one, buy the dairy-free version. And that's how you slowly start shifting in and kind of recalibrating their taste buds, their awareness, the things they like, to the dairy-free option. And I have a lot of parents who, when I talk to them, so I do follow-ups regularly with our families, they'll go, oh, it wasn't so bad. I thought it was going to be really hard. I thought it was going to be awful to change our kid off of dairy. And they go, he didn't even notice. He's fine. So keep that in mind also, right? The energy is the same way I talk about with our supplements. The energy we go into something with is the energy they're going to pick up on. If you go in an energy with this is really hard, this is really challenging, they're not going to like this. What do you think they're going to do? They're going to go, this is really hard, this is really challenging, they're not going to like this, right? So just go in with the idea of like, this is the best thing for their body, and I'm allowing their body to heal even greater by removing this thing that is offending them, that is causing actual harm in their body. Inflammation in the gut is inflammation in the brain. So understand that too. So tape that away slowly, and even just that alone, you'll see differences. It can take up to a couple months to get fully out of their system. But once the body stops going against it, now the leucovorin still works, but now it can work even better. It's not being blocked. The body can take up some of that methyl tetrahydrofolate that if there's no other issues in breaking it down, the body can take up that version as well. So now we're flooding the brain with more. And then the question I get is, okay, well, how long do my kid have to stay on this? Well, how long do you want them to have the improvements? If they need this to supply their brain with the proper amount of vitamins, then I would say at a minimum, the dairy-free has to stay, right? We don't want to produce more antibodies, because even though you go negative, I had a kid recently who had a test 2 years ago, went dairy-free. We did a test because it's part of our package here with the testing and with the cells that we use and everything that we do in our office. And the test was negative. It's just because he's not eating dairy that it's negative. But if he was to start consuming dairy, the likelihood of that going up is very high, because he's already, there's just that cell, the body always kind of has remembrance, has a memory cell. So it will start attacking that again at some point if we haven't sealed the gut really well. And so I would say for life is just easiest. And once they're used to it, like, why would you go back and then go back, right? So, so then I would say at least dairy-free for life. And maybe at some point they can come off some of the leucovorin. You can see if they're really affected. You can half the dose. And, that's something that always be talked about with a practitioner. But, and maybe over time, because they're not producing it now, their cell can actually use it properly. And they don't have to use the leucovorin, but they just have to use the methyl tetrahydrofolate. So that's always an option. But I would say as long as their brain needs the extra help, needs the extra vitamin, keep them on it. Like, don't take them off of it, because I have, and I'll share it to you this way. I mentioned in the beginning, this is dose dependent, and it really is. One of my families was saying that their kiddo was at 10 milligrams twice a day, and we bumped them to 15 twice a day. The difference from 10 to 15 was pretty large in their ability to make more words and have more sentences. But they started having some side effects. We had to take them down to the 10, And that ability went away. Those words, the increase trying and attempts at words went away. So there is a dose depends. I think it really just comes down to how much does the brain actually need. And once we hit that threshold, then you start seeing those greater changes because it's working on multiple processes, right? Not just one, it's like hundreds of processes that this folic acid or folinic acid is working in. And so there is a point at which it is dose dependent. So sometimes parents will tell me, hey, I was put on leucovorin. My son or daughter was put on leucovorin, and they said, well, we'll just try it for a little bit, and it was a low dose, and it doesn't work. We'll just take them off of it. And I was like, well, that's not right either, because if you put them on a low dose and you don't have the testing, so you don't actually know if they're positive and how much they need. But even if they're negative and you don't take away the dairy, then you go, well, low dose didn't work. Well, that's a disservice to them because it could have worked. You just, A, didn't go high enough. B, didn't remove the dairy to see if we take away that interfering substance, can they actually then, because a lot of parents say just don't take away dairy, they see improvements in their kids. And so understand that, like, that's why you want to work with a practitioner that knows what they're doing, because we titrate up appropriately. We look at the testing, we correlate all the data, and then we say, this is how we're going to move up, and this is what the signs and signals we're watching for. So things to be mindful of as far as side effects, hyperactivity, irritability, mood issues, sometimes a little bit of anger. And that usually happens in the first 3 days. For the vast majority of kids, first 3 days, and it goes away, it settles. Very few of my kids that hyperactivity lasts longer. And again, I don't actually think it's the folinic acid. I think it's a filler that's causing them to be a little bit more restless or have moodiness. And that's another reason work with a provider that knows what they're doing. Because in that case, I don't just take them off. I back them down to a lower dose. Or I back them down to a lower dose and say, okay, let's keep them here for longer. Instead of going up every 2 weeks or a month, let's just give them longer for the body to get used to it. Keep in mind that rusty factory is just trying to figure itself out. It's trying to rework the system, re-oil the wheels, if you will. And so until that happens, it's going to get backed up easier. And I think that's where these symptoms are coming from. When we go slow, some kids, you might have to go every other day at a very low dose until they get used to it. And then you keep moving back up. It's the same thing I find in my detox. Some of my kids, I have to detox them super, super slow, even though I have a very basic detox. And we just go up slowly. So their body is going to tell you. If you're having a lot of issues, it's likely because something else is happening and their body just needs more time, or they need more detox support, like the vitamin. And so or they need a cleaner version. Like, there's a lot of things to consider, but those are the symptoms to look for. And persistent hyperactivity is like the bigger thing that we see, but usually it settles out. Those first 3 days, those mood issues settle out, and then it's very minimal. And so most parents say they don't think the hyperactivity is any worse than baseline. And can you take this med with other medications? Absolutely. We have a lot of kids on things like guanfacine, risperidone, sertraline, Abilify, like lots of different meds, and we haven't had any issues. And so, we will that's why I say work with a practitioner that knows what they're doing. But that is not so much in a nutshell, because this was a little longer, but that is FRAT test. That is leucovorin. That is how is it working in our kids and what kind of things are we seeing. And I hope that helps you understand kind of the excitement in the use of it, but also helps you understand why it's so important to work with a practitioner that understands. And here at Innate, we understand what we're doing. Dr. Ashley and I have been working with this. We do understand what we're doing, and we can get you and your kiddos the best outcome possible because we do understand. So exciting news. And I'm happy to share this with you. And if you have questions, please reach out to our office, or reach out to any of the staff.